To picket against hospital groups, the Competition Commission and the National Department of Health against the high rise of healthcare costs in the private healthcare industry. Let's get the very latest now. Nothando Magudulela is joining us live from Sandton. She's covering the story for us. Nothando, very good morning to you. What are you witnessing this morning?
Hi, Blaine, and thank you. We are here at the Nedbank head offices in Sandton, where Nehawu is picketing outside, saying that they have a demand to the government, to ask the government to intervene in the collision and high price fixing of medical schemes. And today I have here with me the Deputy President of Nehawu to speak to us and give us more information on this story. Hi. Thank you so much for having this interview with us. Please tell us, why are you here today? Why are you picketing?
Well, through this picket, we are doing a number of things. One of it, we are fighting against the commodification of health of our people. I mean, you can see that the hospitals were gathered in front of it here, together with its subsidiaries here, your Discover and Life Care, are the ones that are monopoling the private healthcare system. They are the ones that are consuming a lot of the budget that is coming from the government in support of a two-tier healthcare system. We are fighting in defense of the national health insurance, which has become under so tremendous pressure now by the opposition parties and those who seek to protect the privilege of the few. We are fighting here to say to the government they must expedite the signing of the National Health Insurance Bill into law. We want a universal health care coverage that is affordable, that is quality, that's accessible to all South Africans as soon as yesterday.
Thank you. And please tell us one of your demands from government. What are they?
Like I said, they must expedite the issue of signing of the bill, but we're also saying that they must rein in on this private hospital. They must also to the Competition Commission. It must also rein in because these three hospitals are practicing an anti-competitive nature. Recently, the Competition Commission has already discovered the fact that there's a price fixing, there's a collusion in the dispensary of the medications and also the provision of the healthcare. So we're demanding that to the department, that the health department must be sure that it has got the support of South Africans. They must be sure that the provisions of health to our people is a constitutional right and also it's an obligation of the state. It should not be depending on whether a person has got a medical aid or whether a person has got money and how deep the pockets go. It must be the fact that these are the people who need social services like health from the people, from the government.
Okay, and who will you be handing out the memorandums to?
We're having 4 memorandums. One we're handing it to Netcare, we're handing to Competition Commission, we're handing over the Discovery, and we're also handing it to the department to demand the things that to these private hospitals we're demanding that they must stop abusing the trust that the patients have with them. When I take up a medical aid with one of them, they hospitalize me for more than it's necessary. They give me treatment that is more than necessary just because they want to access my medical aid. And once my medical aid is exhausted, they're taking me back to the public hospital, which is the place that I was supposed to have been in the first place after they've got my services in the medical aid.
Thank you so much.
Pleasure.
Hi, Blaine. As you have heard from the Deputy President of Nehawu, saying that they demand for the government to intervene in the collusion and the high price fixing of medical schemes, and they demand that the private health sector must not break the trust of their patients and not to keep them for longer periods that are not clinically necessary.
Nothando, thank you very much indeed for your reporting. Okay, so from Sandton, Johannesburg to the port city of Durban we go, where the IFP is expected to hold a march.